here in Florida. Our patient is a Floridian. Our first two surgeries, one was from Iraq, a doctor from Iraq, and the second one was a patient from Los Angeles, California, and now we have a Floridian. This gentleman has back pain. His pain is coming from 6 specific sources, 6 sources. 2 discs that are damaged, L4-5, L5-S1, and bilateral sacroiliac joint pain, bilateral piriformis muscle pain. Bilateral means both sides. Every human being alive has 2 sacroiliac joints, 2 piriformis muscles, and 5 discs in their lower back. The bottom 2 discs are the most common to be symptomatic, causing back pain. This patient has 6 things causing back pain. Henry, while we're getting started on the Deuk laser disc repair, why don't you show our audience the 30 different things that do cause back pain. I'm Dr. Ara Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Well, welcome back. You're watching the most advanced spine surgery in the world, endoscopic transforaminal Deuk laser disc repair for treating back pain. Why? Because 90% of back pain is due to disc injuries. Disc injuries. Okay? About 10% is due to facet pain, which are little joints in the back of the spine that get injured and get arthritis in them. That arthritis causes pain. Sacroiliac joint pain or piriformis pain. It turns out piriformis is underdiagnosed in most people, and it's a really sharp pain right here in the buttocks, right in the top half of your buttock. The sacroiliac joint pain is right here. You've got two SI joints. So we've got SI joint, piriformis, SI joint, and we got two discs. So disc pain is the #1 cause of back pain, and the Deuk laser disc repair, you're watching it right now, is the best treatment in the world. Why? It's the safest and most effective treatment in the world. Are you awake?
How are you doing, my friend?
You having any back pain?
Hi, don't move, okay? Don't move.
You having any back pain?
Are you having any pain right now in your back? Yes or no? No. No.
All right. You comfortable? All right. How long have you had back pain for? How long have you had back pain for?
5+ years.
5+ years. All right. How bad is that pain on a scale of 1 to 10? How high does that go?
What number? 7.
What's the highest it goes?
9.
Is that where you get your back pain? All right, that's L4-5. We found one of the bad discs. You guys see that blowout there? Jordan, show them the tear in the back wall where the pain is coming from. Circle it. It's the black stuff. That is the tear, folks. There should be 0 black there. It should be white. Because there's black, that means dye is leaking out, getting there, and it's causing reoccurrence of this pain. Is it better now? Good. Is that pain gone? All right. How bad is that on a scale of 1 to 10? The highest it goes? 10. Is that where you get your back pain? Good news, we found both discs are causing your back pain. We're going to fix them. When you wake up, that pain will be gone. Just count out loud to 100 in Scandinavian. All right. So he's a good guy. But we just confirmed that 2 discs are causing his back pain. Do we have any questions?
At this moment, no current questions.
All right. Huh? Take your time. We've looked at the 30 causes of back pain. What about showing the audience why is it that an injured disc causes back pain? What's the mechanism? What's the way that a disc causes so much back pain? And by the way, this was figured out here at Deuk Spine Institute 20 years ago. We've been teaching the public about back pain, its causes, specifically where that pain comes from and why it's there, for 20 years. I've been publishing papers, giving lectures around the world. I've gone to Hong Kong, Global Spine Conference, talking about it. We've gone to all the big neurosurgery groups here in the United States and spoken at the meetings. So why is it that discs cause back pain? Henry, show us the video.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Okay, you can see from our video that trauma to the spine, such as a fall or car accident, will cause a tear in the back of your disc, which then allows the herniation to get out. That herniation then will go through the tear, trying to escape the disc, and it'll cause your body to attack it when it sees it. We call that an inflammatory response. It's the inflammation of your body attacking that herniation over and over again over years. That inflammation is what causes the back pain. So back pain, neck pain, all of your back pain, 100% of back pain, chronic back pain, comes from inflammation, 100%. The question is, where is the inflammation? And people know this because they take anti-inflammatories and it helps. It doesn't cure the problem, but it helps the pain. So this surgery is the only surgery in the world that will cure back pain from a disc, because it was created specifically for the purpose of directly attacking the source of back pain, which is the inflammation in the back of the disc, the posterior annular tear. Any questions?
At this moment, no current questions.
Let's show the audience how the Deuk laser disc repair works.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. You can see from the animation how we can go inside the tear and we do what's called a debridement. And I'm the one who created this procedure. I'm Dr. Deukmedjian, the founder. And it's a procedure where we go in with a laser and basically do what's called a debridement of the tear in the back of the disc. If you get the painful disc and you do the debridement like we're doing right now, you can cure the patient's back pain. And of course, you're going to cure their leg pain too, because you're fixing the herniation that's pinching or irritating the nerve root. This tube is 7 millimeters wide, external outer diameter. What's the difference between outer diameter and inner diameter? Outer diameter, if you measure the diameter of the tube on the outside, that's the outer diameter. If you measure the diameter of the tube on the inside, it's the inner diameter. There is a difference. The difference is the thickness of the metal that is making up this tube. This is a metal tube. It's actually a very expensive tube. We've gone through a few of them over the years because some of our patients' backs are so tight, so spasmed that they crush the tube. And they will literally bend the tube from the pressure of their muscle spasms and their disc. This patient is doing fantastic. We just tested both discs. One was a 9 out of 10, the other a 10 out of 10. When you're doing a discogram or test to see if that disc is painful, you always record the highest number, not the lowest, the highest that the patient experiences. In his case, he had a 9 and a 10 at L4-5, L5-S1 respectively. Right now, this is the herniation right here. We're zapping it away with a laser. The reason there's a gold color to it, shouldn't be gold, but that's calcium. So why does a herniation have calcium? Because of the chronic inflammation brings calcium to the herniation. The herniation normally does not have this calcium. It only has the calcium when it's been here a long time and the body has been attacking it for years and laying down calcium, okay? Calcification of the annulus and the inflammatory tissue of like the herniation and the inflammatory tissue only happens after many, many years of inflammation happening. This patient's had back pain for well over 5 years, on and off. What happens to a herniated disc? Does it ever heal on its own? No. Herniated discs never heal completely on their own. They never do. They must have this surgery. There's no other treatment in the world that works. This is it. And the disc itself will start to feel better. Your back pain may get better if you take it easy, don't do anything. But it's going to come back as soon as you get active. Okay? That it limits your activities because every time you get active, you get more pain. Look at that herniation there. This is a beautiful herniation. This is my favorite kind of herniation. Okay, why? Because if you look how the laser is working in the tissue, it's zapping it away so easily, it's just disappearing, right? Right before your eyes, it just disappears. And I love that. I don't like the herniations that are extremely collagenous and they take forever to get rid of. This one goes away quickly. There's your tear right there, you can see it. We're kind of working this tear inside out. We start at the inside. It's called the inside out technique. I learned this technique from Dr. Anthony Young. Dr. Anthony Young was an Chinese orthopedic surgeon. He's of course American. His son Chris Young still works. He's out in Phoenix, but Chris really likes doing more invasive type surgery. I used to do the invasive surgery that Chris Young likes to do. I stopped doing it and started doing less invasive surgery. Why? Simply because this surgery I'm doing right here that I pioneered is far better than any other surgery. And the reason it's better, I'm going to tell you why it's better. Number one, it actually gets rid of your back pain and leg pain 100%. Okay? That's coming from the disc. So if I'm operating on this disc right here, and this disc is the cause of your back pain, it will get rid of the back pain from the disc, period. It does it every single time. I've never had a failure, not one. I've done 2,700 surgeries. Okay? Now, if you have two discs that are causing back pain, you got to have both treated because fixing one of them is not going to get rid of all your back pain. But this surgery is the only surgery in the world that gets rid of the back pain coming from a disc. Every other surgery does not. Second, the recovery is so fast. It's literally 1 hour. If you have invasive surgery like fusion, then you're looking at months and months of recovery. With this surgery, you can go back to work the next day. You can go back to most activities with some minor restrictions of lifting. Now, the third reason this is the best surgery in the world is because we've had 0 complications, no complications in 20 years. That means it's safe, right? What's the worst thing that can happen from surgery? You have a complication. Okay? The second worst thing that can happen is it doesn't work, right? What's the worst thing that can happen if you have surgery? Number one, you're worse off afterwards because you have a complication. Number two, the surgery didn't do the job it was supposed to do, so it didn't work. So those are the two things that people are afraid of, being worse and the surgery not working. Okay, if the surgery works, but you have a heart attack during the surgery, you might say, well, at least my back pain's gone. I had a heart attack, but my back pain's gone, right? And this happens all the time, by the way, with invasive surgeries like fusion, microdiscectomy, laminectomy, artificial disc, mild procedure. People have heart attack, stroke, infection, and the patient says, well, at least my back pain's gone. But it doesn't go away. That's the problem. Those surgeries, your back pain never goes away because they're not fixing the source. This is the only surgery that actually gets rid of your back pain when it comes from a disc. If you have back pain from a facet joint, this surgery won't work. This surgery doesn't cure all back pain. It only cures back pain coming from an injured disc. That's why it's so important that I meet you first and see where your pain is coming from. Because if your pain is not coming from the disc, it's coming from something else other than the disc, this surgery will not work for that pain. It will still work for the disc pain, it won't work for the other pain. Any questions?
We have a comment and or seeking advice coming from Daryl on YouTube.
Hi Daryl, welcome.
Saying, I have 2 lumbar surgeries since 2020. My sciatica is back. This sounds like something possible for me.
Yeah, Daryl, this is exactly what you want, or the piriformis. Your sciatica is either coming from the nerves, the nerve roots in your spine being pinched or irritated, which I could tell you in literally 1 minute if I can examine you on Zoom. We have a free MRI review for anybody who wants to meet me and get a diagnosis. What's causing their symptom? I'll do it for free. I do it virtually. I do it 2 days a week. I do it for anybody in the world. It doesn't matter if you're going to come here and get fixed or not. I will help you. I will give you a free diagnosis. That's the most valuable thing you can get from me for free. I can't do your treatment for free, but I can do your diagnosis for free. Okay? Once you know the diagnosis, then we know what to do. There's 2 things that cause sciatica. One is a herniated disc with a pinched nerve or irritated nerve, which I can tell you if you have or not. And 2, piriformis muscle tear. Piriformis syndrome, they call it. Those are the 2 causes. And I'll bet you that you have one or the other. And I can fix both. So yes, this is probably, at least Deuk Spine Institute, is what you need. Come do a free MRI review. If you submit your MRI images today, I could do your MRI review by Friday. Okay? Just schedule a time with Natalie or my team, and they will get you in, and I will tell you exactly why you have sciatic pain. All right. So going down that list I was telling you guys about. So number 1, this is the best surgery in the world. Why? Because it cures back pain coming from the disc. No other surgery does. Number 2, the recovery is literally overnight. By the next day, you can go back to normal activity. All right, minus some lifting restrictions. Number 3, we have had no complications with the surgery. Every other spine surgery has complications, which means you can be worse off afterwards than you were when you started. Number 4, you can go back to regular activities such as work and hobbies right away with the surgery. Okay? So those are, plus we do everything in-house. If you come here, we can do an MRI, we can do your labs, we can do your surgery. Right now the patient is coughing. Okay, you guys see that? We're inside the disc. You can see what coughing does. It puts pressure on the disc. Is he okay? We need light. All right. You think he vomited? Yeah, get the sucker over there. All right, so the patient was coughing. We don't know why, but we're going to find out. But you could see the coughing going on inside the disc. So the anesthesiologist is looking. He's going to check his airway. What do you see? It's good? All right. Just about finished. I'm almost done with this disc. I need 30 seconds and I'll be done. Any other questions?
No current questions, so we do have a comment from Daryl once more
Sure.
on YouTube saying, sounds terrific. Free is better than cheap.
Exactly. Free. It just takes a few minutes of your time to give us your MRI and fill out our questionnaire so we know what's wrong. All right, I'm done. I got 10 seconds left. This is the L4-5 left approach. Everything is going really well for this patient from a surgery standpoint. And Henry is going to show the audience the comparison of Deuk laser disc repair versus other treatments. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. Welcome back. We are just wrapping up L5-S1 on the right side. You guys have been watching our video that compares. Is that the Deuk laser disc repair versus other treatments?
Correct.
So you can see from the video, there's no shortage of treatments that doctors will offer patients with back pain and disc problems, but those treatments don't work. That's why we don't do them at Deuk Spine. They don't work. What does work mean? Work means it cures your back pain. Cure means the back pain goes away permanently. And I'm talking about the back pain from the disc injury, not all your back pain, but it has to be back pain from the disc, and it has to be the disc we're operating on. That's what it'll take away. About 20% of our patients we see and treat with this surgery, they come back because they have pain from something else other than the disc. All right, we see it all the time. Remember, the diagnosis of the source of back pain requires that the patient show me where their back pain is coming from. So if you're not having back pain at the time that I'm examining you, coming from your SI joint, for example, then I won't know you have SI joint pain. I'll ask you about your SI joint during the exam, but you may say, no, it doesn't hurt there. If that's what you say, then obviously I'm going to think your SI joint's not the source of your pain. It's just the disc that you're having pain at. But if you have pain at your SI joint, I need to know that. Some patients are so drugged up on medications at the time that I examine them that they don't have the typical pain they always have because they're on medicine, pain medicine. The pain medicine is masking a lot of their symptoms. So it's always best if you're going to do the Zoom call with me, the free MRI review, then you don't take pain medicine that day and you let me see where your pain is coming from. I'm going to need you to point to where it is. I'm also going to ask you to press on some areas of your spine. Just about done. I got about another 2 minutes left on this disc, and we're going to be finished here with the disc. Is he okay? Then we're going to move on. I'm sorry? Well, the disc I'm done, but we got to do the SIs and the peri, unless you don't want us to, which we can hold off if you're concerned. What do you want to do? Wait. All right, you got it. Any questions, Henry?
At this moment, no current questions.
All right. Yeah, no, I understand. You tell me when we stop, and I stop. He's a Floridian, so we can always bring him back if we had to, if it's not safe to proceed, and we can do it later. It's always nice if we can get it all done today, but if not, that's fine. I don't care. Whatever's safest for the patient. It's all about patient safety. Wow, a lot of scar tissue here. You see all that inflammatory tissue? All the pink stuff? That's where the pain comes from. You guys saw the video just a few minutes ago. That's what that pink tissue looks like when you're looking at it with the endoscope. Just so you know. This is it. We're just finished with this disc. I'm outside the disc right now. Just doing my last touch. And then we're going to be done with the surgery. So if you have any questions, ask them now, as we are just about finished. There's the outside of the disc. So we are now outside looking in. Any other questions, Henry?
At this moment, no current questions.
All right, let's go ahead and end the stream, and we're going to come back with our bilateral SI joint DPR.